All right, good. Thank you very much for joining us today, ladies and gentlemen, on this glorious Wednesday afternoon. We're here to listen to Dr. Jim Conahan talk about his experience with Sea International and some of the really amazing expeditions he's done with us. Jim joins us from, well, he hails from Highlands Ranch, Colorado. And he's been with us since, I think, 2006, if my notes are correct. Is that right, Jim?
Yes,
2006, yeah. And he's made a number of trips. What is it, about 2 a year, I think it is, for the last several years, down to Mexico. He usually does large groups of people doing cataract surgeries, sight-restoring surgeries, really amazing work. But in particular, over the last couple of years, he's done a couple really, really special trips for us. And I'm going to let him tell you all about that. But besides that, just on a personal note, Jim is really an inspiration. I love talking with him every chance I get to. The strength of his conviction and his humanitarian spirit is really the sort of thing that Sea aspires to exemplify. It's just really always a joy listening to him and just hearing how altruistic he is in spirit. Anyway, I'll let him tell you all about that, though. So go ahead, Jim.
Well, thank you very much. I appreciate the opportunity to have a webinar with all the listeners. I can't thank International enough for their support. Sea International, if you wanted a capsule 30,000-foot view of what they do, is they take surgeons like me who want to do mission work, and they supply us with all of the supplies. So for instance, in real dollars, coming up in October of this year, October 17th, my team and I will go down to our mission site in Zihuatanejo, Mexico, and we'll do about 175 cataract surgeries. And Sea International will supply us with the materials to do that. And the dollar figure on that is probably somewhere around $150,000. So it's an incredible blessing to have Sea International as a partner with my mission called the Mission of Healing Eyes. So thank you for that, and thank you so much for everyone who's listening that supports Sea International. Our mission is called the Mission of Healing Eyes, which is a group of very, very dedicated volunteers. We have about 10 of us who go down on each and every mission and have since 2006. This will be our 20th mission down to our mission site in Zihuatanejo. And Zihuatanejo, if you're not familiar with the landscape of Mexico, is on the west coast of Mexico in between Acapulco and Puerto Vallarta. It's an extremely beautiful seaside fishing village, but it's also extremely poor because all surrounding it is nothing but mountains. So the only thing they have in this populace in the state of Guerrero is the beautiful beach and rugged terrain and nothing else. So for many, many missions, we've set up down there in the same place. We've been blessed to have the Mexican Naval Hospital donate their facility. So we get to operate out of a very comfortable and nice facility that the Mexican government donates to us. But the history of my mission starts back in about 2007 when I was visiting there with my family, Molly, who's my wife, and my 3 kids, Megan, Matt, and Brian. And fortunately for me, I'd been able to do a lot of mission work down in Mexico. So my children had participated with me, and my oldest daughter at the time, who was all of about 11 or 12, had gone over to the market. And in tow, she comes back to the beach while my wife and I were vacationing, and she says, "Dad, nobody at the market can see because they all have cataracts, and we need to start coming down here and doing a mission." So out of that humble beginning of just the 5 of us starting to go down there, it has grown into this huge blessing where we'll usually go down in October mission and see about 1,000 people in the clinic. And of those 1,000 people, we will invariably find about 500 of them are completely blind from their cataracts. We typically then operate on about 175 to 200 of them in that October mission, and then we carry over the other remaining and go back down in May and finish the backlog. So I believe at last count, I asked Molly this, but we are fairly close to doing almost 2,000 cataract surgeries. And these are cataract surgeries that are not your average run-of-the-mill, hello, Dr. Conahan, I'm kind of blurry. They're cataract surgeries that if you put your hand over your face and all you could see was light, that's what these patients are. So imagine having no vision one day and the next day taking off your patch and having vision in one eye. That's really what it's like. And truthfully, the stories that have come out of this mission, I can't even begin to describe, but just one very quick one was we saw in our last mission, my wife Molly let in somebody from the mission field who was completely blind and about 55 years old, and I'm 54, so it really hit home. And he walked in with his cane, and he was the local muffler repairman, and he had quit his job about 5 years before because he couldn't see. And he walked in with his cane, tripped over the trash can, and my wife Molly, who has a little bit of pull with me, the surgeon, said to me, we need to do him today. And so we did his cataract surgery that day, and the next day when he came in, he walked in with no cane, and he was on his cell phone calling his boss trying to get his job back. So those are the just one of the many, many stories that we get. Steve had asked me to talk a lot about, or a little bit about, our experiences with some of the children down there, which are always heartwarming. So the first time,
if I may lead into that
please.
A little bit too,
yeah, please
Jim.
do.
What would you, well, with a question, would you say that in general the patients that you operate on, they tend to skew older?
Yes, I would say just like any cataract population, the majority of our patients are elderly and probably older than 70. But in this population, for some reason, there's a definite disproportionate amount of middle-aged people who are blinded from cataracts. It's very much different than in the United States, where it's very unusual to even see somebody my age with a cataract. And so I think it's probably a combination of the nutrition, combination of being close to the equator, and a poor, like I said, a poor diet. So those variables. But you're right. Most of our patients are older.
Yeah, and a lot of these patients, I'm guessing, well, at least I've heard that a lot of these patients will have lived with these cataracts for quite a long time, too.
Oh, it's not unusual. Like, for instance, the gentleman I just mentioned, he'd been completely blind. I don't mean a little blurry, but stone blind for 5 years.
That's amazing.
Yeah.
Anyway, please tell us about the children. This is really a heartwarming story.
So I guess it was probably almost 2 years ago, if I'm trying to think if it was 2 years ago, 2 years ago in October, that we were brought a young little boy. His name is On Heel, so we just have called him Baby On Heel. And at the time, Baby On Heel was about 4.5 years old. And he was brought in by his very gregarious and very humble father, as well as a humble and gregarious mother, to the clinic. And what they do is they sell necklaces and bracelets on the beach. And On Heel wasn't just blurry. He was literally blind from his cataracts that he has been born with. So it was a very heart-wrenching scene to watch him stumble around the clinic, hold on to his mother's apron, and literally not want to leave her side. So we examined him and quickly realized that he had cataracts in both eyes. And the problem with doing a child's cataracts is you can't do them awake, so you have to put them to sleep. Well, it was the October mission, which, as you heard me say, was a very busy mission anyway, and there was no way that I could get things in order. I couldn't find an anesthesiologist. I couldn't get the operating room time. So we literally just had to say, we'll figure this out, and we sent On Heel away, only to promise them that we would do something. And then what we decided to do was Molly and I, my wife, who who is the leader of the clinic and the choreograph of the whole show, worked out that we could fly down there, she and I, and she would assist me in surgery. And then there was a wonderful anesthesiologist down there, Jesus Acosta, who would donate his time and help us put on Heal Asleep, while C International, of course, gave us all the supplies and the things we needed, along with the people who would pray for us and also give us donations to cover the other supplies that we needed. So we flew down and we did on Heal surgery one day. I remember it was March 30th, and we did both eyes on the same setting, took out both cataracts, put implants in both eyes. And what I had to prepare Molly was that, unlike an adult, when you have a cataract in a child's eye, the brain has never really developed. And so I was fully anticipating that, to prepare the team down there, nurses and doctors alike, that the next day would not be the momentous aha moment like adults have, because I thought that, and I tried to prepare them, that on Heal would probably take 6, 8, 10 months, even a year before he saw. But the next day, and truthfully, this isn't one bit embellished, and even though I'm Irish and I tend to embellish my stories, this is not embellished at all. The next day, we saw on Heal, not at the hospital, but in our building where the condominium was. And I noticed right away that as he was walking through the corridor of the condominium, he saw the swimming pool that was associated with the condominium, and he went right to it. And I said to Molly, that can't be. He can't see that swimming pool. And before I could examine him, his mother said to me, on Heal gave me a great, great present this morning. And I said, what was that? And she said, well, do you know that for the first 4 years of his life, every day I would get up and I would have to get him from bed because he couldn't see. I would have to dress him and feed him and then get him ready to go to school, and I would stay with him at school. And do you know, this morning when I woke up, there he was standing at my bedside, and he was petting my face, and he said, Mother, you're beautiful. He said, Mamá, su muy bonita. And she said, I have never experienced such joy in my life as that day. So I then proceeded to examine on Heal, and lo and behold, he was seeing perfectly out of both eyes. Not just good, but perfect. To the point where I had given him, Molly had prepared a little bag of toys, and she handed him the toys, and in the toys were some bracelets and little cars, and he picked out the bracelets, and he tugged on my jacket, and he said, here, take these back. I'm a boy. I don't want bracelets. So out of that, we have since been down, both Molly and I and our team, probably 3 or 4 times, and we examine on Heal every time to make sure he's doing okay. And he's not just doing okay, he's thriving. And I asked his mom how he was doing in school, and she said, do you know that he's not only doing well, but before he was very shy and wouldn't leave my side, and now he's starting to get in trouble in school. So she said, I think that's a good sign. So that's just probably one of the more powerful, if you will, miracles that have come out of the mission. The second thing that just happened on our most recent mission, which was in May, was I had the incredible experience of doing surgery on Kenya. And Kenya is a 3-year-old little baby who has Down syndrome, and she was born with cataracts in each eye. But the interesting thing was her mother. I had met her mother, the mission before, who was all of about 25, and she has 3 children. And the 2 boys, believe it or not, are blind also. And they're older, and they're 5 and 7. And their blindness is not from cataracts. Their blindness is from something in their brain. So here's a mother with 3 blind children. And she has the warmest, greatest heart, and she just looked at me and she said, if there was anything you could do for Kenya, she would appreciate it, but if I couldn't, she understood. So we, of course, got Kenya arranged to do her surgery, and we removed her cataract, And in Kenya, for reasons that were particular for her, I just removed the one cataract. So I think some of the pictures that you might be seeing are of Kenya after, maybe before and during the surgery. But Kenya's surgery went flawlessly, it went perfect, and now we're following Kenya to make sure her vision develops. It's a little harder with Kenya because she's really not verbal to know how she's doing. But I can tell you that from my exam and from her attitude towards me and the rest of the staff, she's seeing very, very well out of the eye we did surgery on. And again, that was an eye that C participated in, donated all the supplies, and just couldn't have happened. This mother told me that in her wildest dreams, she couldn't have imagined that something could be done for her daughter. So she is just very, very appreciative for any and all of the help that we've given her.
Wonderful.
So those are some of the stories. I don't know if you want me to keep going. Honestly, I could go on for hours, but I think your audience would get kind of bored.
No, I can't imagine that. These are really unbelievably beautiful stories that you're telling. Now, as you said earlier with Angel, with Kenya, I take it that had she not been operated on quickly, it might have been that she could never see at all, correct?
Well, I think as a surgeon, I can tell you it's not that she might have been. Had either Angel or Kenya not been operated on, and the magic number is about 6 years of age, if you don't get to the cataracts by 6 years, even after 6 years removing them, they will never restore their vision because the brain loses the ability then to mature. So for all practical purposes, a child's eyes in their brain is matured by age 6. So if you don't get to it by 6, it's locked in. So if the vision is locked in perfectly, by 6, you're going to see perfectly. And if it's not locked in, you're not going to see at all.
And that really underlines how critical your help is with these children. I think most of us probably can't imagine what it would be like growing up in the developing world, never able to see and trying to survive.
I'll tell you, it's amazing. And I just would like to share, now that I'm thinking about it, one other story that Angel's dad said to me. So if there's any fathers listening, but certainly the mothers will, this will tug on your heartstrings. The dad said to me after the surgery, you know, Dr. Jim, I knew that Angel was blind from birth. I've known this. And in his, of course, this is through an interpreter, but he said, so I've carried that, and he used this expression, I've carried this load of bricks on my back for the last 4 years.
Wow.
Because there was never, ever, ever, ever a moment in my life when I thought I could help my son. And he said, do you know what a burden that is for a dad to know that? And he just said to me, today, my bricks are off my back and I walk taller. And I just thought, wow, that's impressive. That's incredible.
It's remarkable, and very, very profound too. Hearing that from the father.
Yeah.
Anyway, I'm going to open up the lines now for questions. If everybody could, who wants to chime in, would just tell their name, where they're hailing from, and yeah, I will unmute you. How do I do this? All right, everybody should be unmuted.
Jim?
Yes.
My name is William Ashford in Jackson, Mississippi, and I've never been on one of your trips before, but we're going to the course in a couple of weeks, and I look forward to joining you on some of these trips. Can you describe what your operating room is like down there compared to the one where we have?
I have not about the candidate videos. In terms of scheduling this, you guys want to to all of the single blocks within one of my districts?
Sure, I'm sorry. I'm getting some voiceover, but yeah, thank you for your question. We have an operating room that has...
There could be 4.
There we go. There we go.
We have an operating room that has 2 surgeons usually operating, and then we have 3 beds. And I don't know if you've ever read the book by the ophthalmologist in India. His name is Dr. V, but it's the model of compassion. And so the operating room that I run is everybody does what they're trained to do, and you don't do anything more and you don't do anything less. So as a surgeon, I sit down behind the microscope, I finish a case, and that bed is then moved out, and another bed is immediately moved in with a patient that's already patched and, or excuse me, prepped and ready to go, so that you kind of stay on your, if you will, that zone of, you know, if Michael Jordan is making 3 points, get him the ball. So
Right.
we try to keep the adrenaline level pretty high in the operating room without a lot of downtime.
Gotcha. So you have like a Zeiss surgical microscope, and you have phaco machines and.
No, I'm sorry. We do all MSIC procedures. So the cataracts I'm operating on are not amenable to phaco. So
Gotcha.
we have to do a small incision expression.
Gotcha. Okay.
Yeah.
Do we have any other questions?
This is David. This is David hailing from Lake Tahoe. I don't really have a question, but I've known Jim and Molly for some time. My wife and I are friends of theirs, and they are both truly such an inspiration to us. The mission work they do is amazing. These stories you talked about today, Jimmy, heartwarming, and I've heard many others. I know you've done cataract surgery on fathers that had never seen their children.
Mm-hmm.
And I can't imagine the joy and what a difference it makes in their life. You're doing God's work down there, Jimmy, and you know we love you.
Well, thank you, David. I know that. I sure appreciate that, and thanks for listening.
Okay, I'm signing off.
Okay, bye-bye.
Bye.
Jimmy, Bill Ashford with another question. What kind of anesthesia do you use?
I'm sorry? What kind of what?
What kind of anesthesia do you typically use? Just a block?
Oh, no, great question. We all do a retrobulbar block.
Okay. Do you give them any sedation at all?
No, huh? No, it's amazing. We learned over the years, again, I would love to hear anybody else's comments, but we block all of our patients in a line, and the first patient, after he gets blocked without sedation, he teaches the next patient what to expect. So everybody calms everybody else down. So they're just sitting in a chair in a row of about 15 people, and then we block 15 at a time.
Wow. How many cases do you do in a day?
With two surgeons, usually the two surgeons I ask, we don't go overboard, but with the model I described, we start at about 7:15, and I ask the surgeon who's operating with me to try to do at least 15 or 16 in a day. So we try to get about 30 a day done, and we operate for 5 or 6 days.
Okay.
Dr. Conahan, this is Randall Avolio. I wanted to thank you very much for taking the time to do this wonderful webinar today. And for the others on the call, I had the great pleasure of going to Colorado and getting to meet Dr. Conahan and Molly. And you wouldn't think you could get good sushi in Colorado, but you can. And they were absolutely, as Steve was saying, an inspiration. And C to date has done 440,000 sight restoring surgeries worldwide over 40 years. And it is because of a network of individuals and like-minded folks just like Dr. Conahan that make that possible. So thank you so much.
Oh, the thanks is all mine, Steve. I've told you before I couldn't do what I do without C International. I'm just praying that you'll be around for another 40 years.
That's the plan.
Yeah, that's the idea.
Yeah, right. Okay. Thank you.
If we have any other questions, please feel free to chime in. Otherwise, we'll wrap this up.
Thank you very much. We look forward to joining you. I'm really inspired by this webinar. This is early in our career of doing this, but my daughter's a nurse anesthetist. She wants to go with me, and we look forward to meeting you soon and going on some trips.
Well,
yeah,
thank you.
And we're gonna have a reception afterwards, 6 p.m. the same day. If you're able to make it to that, it's really fun because you get to meet a lot of the staff, and you're at a beautiful home in Montecito that is the home of our founder. So if you have the time and you're not hopping back on a plane to get out of town, join us there. The food's good, the company's great.
Great. Thank you.
Okay.
All right. Well, thank you very much, Jim. It's been an absolute delight, as always, to chat with you and hear about your adventures in Zihuatanejo. And thank you, everybody, for listening in.
Thank you, Steve. Thank you, Randy, and I appreciate all your help and support.
We couldn't do it without you. We absolutely could not.
All right. Thank you. Bye-bye.
Bye-bye, guys. Thanks.